We have the next session, color coding for segregation of biomedical waste, and it will be dealt by Dr. Aruna Poojary ma'am, who is the HOD of the Department of Pathology and Microbiology and in charge infection control at Breach Candy Hospital Trust, Mumbai. But just those two words or sentences is not enough to describe ma'am. You might have to give me 15 minutes for that. But since we do not have time to spare, I'll just touch upon a few aspects of her. Ma'am is a board certified public health microbiologist and infection control professional with a diplomate from the Royal College of Pathologists. And ma'am is particularly interested in antimicrobial resistance, stewardship, and infection control and prevention, with a lot of close to 200 publications in index journals. Ma'am, I think is the apt person for enlightening us on the color coding for segregation of biomedical waste. So ma'am, the floor is yours.
Thank you, Dr. Deepthi, for that. So good morning, everyone. I think this is a very important quality education series. And as someone mentioned, you know, every day, I think Bharti ma'am just mentioned that every day you will come across a new question on biomedical waste management. So it just keeps evolving, and you have new problems and new solutions. So I'm here to talk about color coding of segregation, color coding for segregation of biomedical waste. Let's very quickly go through what really happens to biomedical waste in the hospital and what happens ultimately. So about 15% of the waste that is generated by any healthcare facility comprises of biomedical waste. This waste gets segregated, it gets collected at the various clinical areas or wherever it is generated. Some of it might undergo what is called as pre-treatment. Now, we need to be very, very careful with the words that we use. Pre-treatment is something that happens within the healthcare facility, and treatment is something that happens at the common biomedical waste facility. From there, it goes through meaning intramural transportation to a storage area, usually which is within the hospital premises or healthcare facility premises, often called as a central waste area, where we weigh the biomedical waste and keep those records for documentation. And then subsequently, this waste is picked up by authorized personnel who will transport this waste to the common biomedical waste treatment facility, where according to the category of waste, it undergoes treatment and will be finally disposed of, depending once again upon the type of waste that it is. Some of the very basic tenets of managing biomedical waste within healthcare facilities would be always segregate biomedical waste at the point of generation. This is something which is very, very important to keep us healthcare workers as well as our patients safe, because if the person who is generating the waste does not segregate it, it's a risk to the next person who comes and either gets exposed to it for either segregation or might inadvertently get exposed. Similarly, biomedical waste bags and sharp containers should be filled not more than 3/4 full. This is also something important, keeping in mind that these bags need to be closed. So there needs to be a proper headspace in order to allow proper closure. Again, very important from the point of view of healthcare worker safety. All bags, containers, and bins must be labeled with the symbol of biohazard or cytotoxic hazard. That also is something which is very important, again, to identify, and everything as you go ahead is from the point of view of safety of those people who are handling this waste. Interim storage from various departments must be in the dirty utility rooms and sections. So this is in the clinical areas. In-house transportation of the waste from the site of generation or interim storage, that is the dirty utility rooms, would be to the central waste collection, which is located within the premises of the healthcare facility. And this transportation from the clinical area to the central waste area must be done in a closed trolley. And this is maintained in that central waste facility until the authorized dealer comes and picks it up from the CWC to take it, transport it, and then finally treat and dispose it at the central biomedical waste treatment facility. So according to the Biomedical Waste Management Rules 2016, Currently, biomedical waste is categorized into these 4 categories, that is yellow, red, blue, and white category. In the subsequent slides, we look into each of these categories and we look into whether pre-treatment is required or not. So remember, I mentioned about pre-treatment. Pre-treatment is something that is to be done by the healthcare facility. We almost negligibly do any kind of treatment, but pre-treatment is something that that is suggested for different categories of waste, and we'll go through each of them in a little greater details in the subsequent slides. So biomedical waste rules 2016, as I mentioned, categorizes biomedical waste into yellow, red, white, and blue. The yellow category is further subdivided into 6 sections. A, human anatomical waste; B, solid waste; 3, expired or discarded medicines; D, chemical waste and chemical liquid waste; E is discarded linen mattresses which are contaminated with blood, body fluids, mask, and gown. And finally, it is microbiology, biotechnology, and other clinical laboratory waste. So as you see here, laboratory waste is categorized completely separately, and although it comes under the yellow waste. Then in red, we have contaminated plastic waste. In white, we have white sharps, including some metals like needles. And then you have blue, wherein you have metallic body implants, and you have glassware. So let's look at each of these in details. So in the yellow category, we have human anatomical waste, which comprises of human tissues, organs, body parts, fetus, limb, all of these are included. This also includes placenta and extracted tooth. Here we segregate them into yellow non-chlorinated bags, and there is no pre-treatment performed within the healthcare facility. Similarly, for animal anatomical waste, this comprises of animal carcasses, body waste, body parts, organs, tissues, animal waste that are generated during experiments or testing in veterinary hospitals or colleges or animal houses. This again goes into the yellow non-chlorinated plastic bag, and we do not do any kind of pre-treatment within the facility. Then comes solid waste, which includes blood, body fluid, contaminated items, which could be caps, shoe covers, gauze, wooden swab sticks, paraffin blocks, indicator tapes, disposable mask, and gown. All of these also go into non-chlorinated waste. So avoid any kind of plastics over here. It is basically non-plastic waste, which goes into this yellow non-chlorinated bag. Again, here we do not do any kind of pre-treatment in the institution. Then comes expired or discarded medications. This includes cytotoxic drugs also, along with their ampules or vials, because the cytotoxic part of it is more important. So this again is not pre-treated in the institution, and it goes into the yellow non-chlorinated bag. Remember that for the cytotoxic waste, the symbol is different from the biomedical hazard waste. Then for chemical waste, for this, there are different chemicals which are, which could be, or their containers. This could include chemicals and disinfectants. Again, here there is the yellow non-chlorinated plastic bag, and no pre-treatment is performed within the institution. Then there are liquid chemical wastes also, which are generated during various procedures within the hospital. These could be discarded disinfectants, X-ray films, discarded formalin, infected secretions, liquids coming from the laboratories, floor washings, etc. Here, there is no, it is not contained in a bag, but this is a little bit different from what happens with the other waste that we have seen till now. Here, what is done is basically, if it is a chemical waste, then it is either pre-treated with chemicals to neutralize or precipitate. And if it is an infected liquid waste, then it is disinfected with 1% sodium hypochlorite. And further, this goes through the ETP. And for some of us, it might also go after treatment, go into the STP. So this category of waste is something which is pre-treated as well as treated at our own end. And we don't send it to the common biomedical waste facility. Then comes discarded linen, mattresses, beddings which are contaminated with blood and body fluids. Here again, yellow non-chlorinated plastic bag, and no pre-treatment to be done in the hospital. And finally, microbiology waste, or for that matter, any kind of laboratory waste or biotechnology waste, which again goes into yellow non-fluorinated plastic bags. And here, prior to it being sent to your central waste area, one needs to ensure that they are sterilized. So this sterilization process could include autoclaving, it could include microwaving. So any of these methods need to be utilized, but it cannot go to your central waste area without undergoing a process of pre-treatment, which is essentially sterilization. So these are the different kind of waste that go into the yellow bag. Moving on to onto the red category of waste. So the red category of waste essentially comprises of plastics. Now, these could be contaminated plastics or they could be non-contaminated plastic. That is immaterial. What needs to be there is plastics. These are generated from disposable items such as tubings, IV tubes and sets, catheters, urine bags. I saw a question on urine bags. So please note that it goes into the red category waste. Syringes, but without needles, or for fixed syringes, you need to have the needle hub cut. Vacutainers and gloves. Here again, they go into, as we are discussing, a red non-fluorinated plastic bag. There is no pre-treatment done at the healthcare facility except naturally for the waste that comes from the laboratory, including vacutainers with the blood sample. These need to be pre-treated, which is by the process of sterilization and then segregated as red category waste. So that these are the different materials that go into the red bags. As you see, plastic is what is essential. So the important word is plastic, which is eventually treated and then recycled. So plastics will go into the red category, including all the waste coming out from the plastic waste coming out from the laboratory. In the Q&A, I also saw someone talk about these pipette tips. Actually speaking, if you are discarding something as laboratory waste, you don't need any kind of sodium hypochlorite disinfection process. Instead, one needs to, before it is discarded, it will have to go through a process of sterilization. So it is being treated at your end, pre-treated at your end before it goes to your central waste collection area. Moving on to the white category, this comprises of needles, syringes with fixed needles if they are not really cut at the hub, then burners, scalpel blades, and any kind of other contaminated sharp object, any procedures, with sharp items being used will all go into this white category of waste. This is basically a white translucent puncture-proof, leak-proof, tamper-proof container. And here again, there is no treatment at the healthcare facility. So please remember, there was a time when prior to the 2016 rules where there was a lot of confusion and commotion about the use of sodium hypochlorite, which could be 1%, 0.5%, more than that. And then the issues about the instability of this sodium hypochlorite solution, which needed to be changed every day. And then the weight of these containers, going to the central waste area. Some people used to decant it, thereby exposing healthcare workers to the risk of both exposure to infectious material as well as exposure to sharp. So all of that has been actually done away with in the 2016 guidelines. You don't need to add any kind of liquid solution into this particular white container. It has to be directly put in and it has to be dry. You don't need to put in any kind of disinfectant solution there. So that's about the white waste. And then we move on to the blue category waste, A, which is mainly glassware, comprising of broken, discarded and contaminated glass and glass slides, glass pipettes if they are used. Mostly they are not used. Medication vials, excepting naturally those which are cytotoxic waste. So if you are dealing with cytotoxic waste, then it is basically the cytotoxicity which is supposed to take importance or significance versus the glass part of it. And here it could be blue. It is basically blue colored puncture proof, leak proof boxes or containers. Here again, there is no pre-treatment to be done at our facility. So there is no disinfection process to be followed, only to ensure that people who are handling will not be exposed either to blood and body fluids or to sharp items. The next part of the blue waste is metallic body implants. So these are various implants that are used for different kind of procedures. And as we have advanced in so many procedures and so many prostheses and implants that we use, all of that can go into these this blue category B waste. Here again, blue colored puncture proof, leak proof boxes or containers to be used. There is again no pre-treatment which is required at the healthcare facility. So if I were to recall, there was pre-treatment required for the liquid waste, which would finally go into the ETP, STP. There is pre-treatment required for the yellow category of the laboratory waste. And there is probably some pre-treatment, meaning of the plastics or vacutainers that is generated from plastic waste generated from the laboratory. So laboratory waste, whether it goes into yellow or whether it goes into red, needs to be pre-treated with the sterilization process. That's about the only aspects of pre-treatment that we really do in the healthcare facility. Remaining part of treatment is actually done by the central waste biomedical facility. So other important considerations, all of this is naturally in accordance to the Biomedical Waste Rules 2016. The autoclave that is used for sterilization of, or rather, if I were to use the word pre-treatment of laboratory waste, should be dedicated for biomedical waste only. And this was an important question that came to us while we were doing the regional workshops. It is essential that particularly in the laboratory, if there's a microbiology laboratory, many of us have a sterilizer or an autoclave to prepare media. Now, if you were to sterilize or autoclave your biomedical waste, you cannot use this sterile autoclave for the process of your biomedical waste. Please note that you need a separate autoclave for the same. One could also use microwaves for the same, but they need to be dedicated. Then chemical disinfection, wherever it is to be performed. For example, the liquid infected waste that needs to be pre-treated, that has to be done with 1% sodium hypochlorite solution or any other equivalent disinfectants like aldehyde, lime, ammonium salt, phenolic compounds. But most of us, rather because hypochlorite is easily available with us, would use 1% sodium hypochlorite solution. And all of these are from these two references that we have taken. And I think that brings me to the end of my presentation.
Thank you so much, Aruna ma'am. It's a topic that I think covers a lot of the queries that are coming up in the chat box. And from what I have seen over the past few months and what I continue to see in the chat box, this is a topic that will never get completely cleared. There is a lot of confusions pertaining. There will be very specific doubts also. So like I promised, there are going to be more sessions. Some of the queries will be eventually covered in the following sessions. But one of the things that ma'am said, I would like to reinforce it because that is also coming up again regarding the use of hypochlorite. The hypochlorite solution, like ma'am said, one of the things is we might start off with 1%, but it's a chemical that disintegrates and the concentration wears off during the course of the day. So at the end of the day, you may be just putting your waste into water for all we know. So that could probably be one of the reasons. And like ma'am said, it increases exposure when you try to decant it. So the whole concept of putting waste into hypochlorite, the laboratory waste into hypochlorite, that is completely done away with. So that I would like to reinforce. And ma'am, we have